Hello to everyone. So today we will see the back care procedure. As we know that the nursing is not only about the MCQ or not about the knowledge, but it is skill based also. So we have to be equipped with the skills also. So today we will see the procedure of back care that is very much important for the bedridden patients. So what is back care? Back care is cleaning and massaging an individual back for therapeutic and comfort measures. Why it is done, what are the purposes of back care. It provides the opportunity to assess the skin, to relieve muscle tension, to promote physical and mental relaxation of the patient, to stimulate the blood circulation, to prevent bed sores, to keep the skin clean and dry, to refresh the client and relieve the fatigue. What are the contraindications? Patient with rib fractures, patient with burns, immediate post-op period, especially in the chest or abdomen surgeries, spinal surgeries and injuries, open wound or infection of the back, bed sore already started to develop. So, what are the articles required? First of all, you need the screen to maintain the privacy of the client, then Macintosh and draw sheet to protect the bed sheets, then towel to dry the patient, sponge cloth for the cleaning, soap and soap dish for cleaning, small basin, two jugs, one for hot water and one for cold water, then powder, oil or lotion according to the weather, bath blanket or top sheet providing privacy to the patient. So now we will see the procedure. First step is hand washing. First of all, you have to explain the procedure to the patient or relative to gain the cooperation from them. Then, after the hand washing, wear the clean gloves because we know that the back care is a clean procedure. Then, after explaining the patient, you have to provide the patient with the proper positioning. The position can be given side lateral or in sitting also. So, what we require soap and water for cleaning. With the help of mitten, we can clean the back with the soap and water. With the help of one mitten, apply the soap from top to bottom. You can use longitudinal strokes or horizontal strokes. Firstly, thoroughly apply the soap and then, with the help of another mitten, you have to clean. After cleaning properly, the clean water, we will dry the patient with the patient towel, or you can use some other thing. So now the cleaning is done. After that, we have to air dry the back with the help of towel. Do not rub because rubbing creates the friction and chances of bed sores then increases. So we have to gently pad dry the back of the patient. So this is the first step. We have cleaned the back of the patient. Now we will move forward toward the massaging. For massaging, you can discard these gloves and you can wear new gloves. Or if you are comfortable, you can give with the bare hand also. But it is better to do with the gloves. So, according to whether I have taken the oil. So this is first step, that is effleurage, small circular movements from down to up and then come down with long stroke. Small circular movement from down to upward and then come down with long stroke. This is effleurage. Then second step we have the battery sound. We have to pinch or grasp the skin between our thumb and index finger, both the sides. So this is petri size. So every step can be repeated 5 times according to the patient condition. If patient tolerates that, then along the spinal cord we can give the step. We have to do like this. Up and down spinal column. We have to provide friction. Then this is the kneading. To the friction, we have the kneading. So we have to apply the firm pressure so that patient does not feel uncomfortable. Then next step is cupping. You can make cup shape of your hand and then from down to up you can do cupping. It comes under the deportment step. So basically the tapping the back with the hands can be done for both the sides. You can use single or both the hands simultaneously. Then it can be done by using the lateral side of palm of your hand. So this is the tapping. So this is all about the back care procedure. So after care, you have to remove the screen, take the article to the utility room, clean those articles, wash and replace, then wash your hands, record and report any observation, and document the procedure. This was all about the back care procedure. Kindly like and subscribe my channel. That is the RNCCN. Thank you so much.